You have to be persuaded, reminded, pressured, lied to, incentivized, coerced, bullied, socially shamed, guilt-tripped, threatened, paid, punished, and criminalized. If all of this is considered necessary to gain your compliance, you can be absolutely certain that what is being promoted is not in your best interest.
First, we must increase vaccinations among the unvaccinated with new vaccination requirements. All employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated. We'll be requiring vaccinations of all nursing home workers, those who work in hospitals, home health care facilities, or other medical facilities. All executive branch federal employees to be vaccinated. All federal contractors to do the same. Family physicians, pediatricians, GPs, general practitioners, teachers, Walmart, Amazon, and Kroger. That's American leadership, and that's just the beginning. We've been patient, but our patience is wearing thin. If you want to do business with the federal government, vaccinate your workforce. This is not about freedom or personal choice. The time for waiting is over. My message to unvaccinated Americans is this: what more is there to wait for? What more do you need to see?
What more is there to wait for? What more do you need to see?
And let's talk about safety. Now, this is the real issue. There are three levels of safety or death that we need to look at. One is acute, one is subacute, and long-term. There is definite evidence that it affects fertility, damages ovarian function, that it reduces sperm counts. Number one. Number two, definitely increases the amount of autoimmune diseases. Who knows over time how that is going to reduce lifespan? And just last week, a paper came out showing that it increases the risk of cancer. So any way you want to look at it, whether in the acute setting, where it causes blood clots, inflammation of the heart, and miscarriages, in the midterm, subacute setting, where it can result in a pathological, disastrous immune reaction, or in the long term, whether it causes autoimmune diseases, cancer, and infertility. Now, that's a big concern. Bill Gates said last year, 7 billion people need to be vaccinated.
It's going to have to go to 7 billion people. That's how we're going to end this pandemic.
The death rate will be over 2 billion people. So wake up. This is World War III. This is a level of malfeasance and malevolence that we have not seen probably in the history of humanity. And I really believe that God is testing every human being. And here's the test. Are you going to bow down to me? Are you going to take your fears and ask me to help? Or are you going to run to the Vodazara of the Egel Hazov, of the vaccine, of your governments, of despots and tyrants, like sociopaths who want to be deities. There's nothing new under the sun. These people are no different than Paro. They think they're God. And you're going to bow down to them. If you're going to bow down to them, let them protect you. Let's see how that's going to work out for you.
I'm Dr. Peter McCullough, and I'm an internist and cardiologist, an academic physician, professor of medicine at Texas A&M College of Medicine on the Baylor Dallas campus. This whole pandemic from the beginning was about the vaccine. So I think all roads lead to the vaccine and what it means. There are already places in Southeast Asia and Europe, they're laying the groundwork for a compulsory vaccination. I mean compulsory. That means somebody pins you down to the ground and puts a needle in you. That's how bad stakeholders want vaccination. Listen, that's not of cost. You don't have to pay for it. It's all provided. There are people or stakeholders, they do want a needle in every arm. This needle in every arm is a very important moniker. Why? See, the tension that Americans are feeling right now as they're trying to keep their jobs and go to work is they know they can die of the vaccine. That's the problem. If the vaccine was like water and you just got it, no side effects, who wouldn't take it? Say, hey, I'll comply. They got my social security number anyway in a database. I'm already marked. I'll just get marked. But no, there's something very unique about this vaccine. It's something about injecting something into a body that is so important to stakeholders that it doesn't matter. Kids 12 years old told they can make their own decision on this, and it could be their fatal decision. Think about that. There are over 4,000 dead Americans. There's over 10,000 dead people in Europe that die on days 1, 2, and 3 after the vaccine. Why are we pushing this in a way where people's jobs and their education and their livelihood decide on a decision that's potentially fatal? The tension, you can cut it with a knife. There are parents that say, listen, I want my kid to go to college this year, but I don't want to lose him to the vaccine. They know what's going on. The internet is full of these cases. Blood clots, strokes, immediate death.
Hey, no, do you guys offer the Moderna?
Yeah, vaccine?
You do?
Yeah.
I was curious to get in that, but my doctor and I wanted to review. Do you know what the ingredients are in that by chance? Like, is there an insert?
There's not an insert.
There's no insert with that?
Yeah, no.
Don't all medications come with it, or?
I think because it's like not officially FDA approved, it doesn't have one yet.
Oh, the Pfizer has an insert though?
Potentially. We don't have Pfizer here, so
oh, okay.
I only have Moderna.
So there's nothing that comes with the Moderna?
Yeah, I mean, I can look and see. But,
okay, that seems kind of interesting.
I'm not seeing it.
Oh, you're not seeing it? Yeah, because I tried looking, and I didn't see anything either. I mean, a lot of people just trust their doctor, you know? So this is getting kind of strange. All right.
Yeah.
Well, I appreciate it. I thought I'd just check with you.
Yeah,
thank you.
Yeah. You're honestly the first person who's like,
I'm the first person?
Yeah.
Oh, wow. Okay. Well, thank you so much for your help.
What have we seen so far over the weekend? Over 1 million kids, you're saying, were jabbed by CBS?
Oh, way more than that, Stu. And we need to stay on this because our babies from 5 to 11 are just getting lined up, okay, like to the slaughter. Over this weekend, CBS alone stated that they jabbed over 1 million children, 5 to 11. And, you know, remember there's supposedly a different formulation. You've got 10 micrograms instead of 30 micrograms, and they've added this very dangerous chemical to preemptively prepare to manage heart attacks, okay? Walgreens boasted that they had 1 million injections ready to go this weekend. And in New York City this morning, the communist de Blasio made sure that at least 20,000 students got jabbed over the weekend in New York City. And this morning, you can see lines of parents with just what looks like hundreds and possibly thousands of children more today that are going to be jabbed. Look, this is really, really a very dangerous time in our history.
Hi.
Hey there.
Hola.
Hi, everyone.
Hello there.
So good to see all of you.
Oh, it really is. But Elmo, why are you dressed? Is it like a clown?
Oh, yes. It's kind of embarrassing. Elmo was having a virtual play date with Abby. Yeah, we were being clowns. It's a lot of fun.
Elmo, but I have to say it's wonderful to actually see all of you. It also sounds and looks like you and your families have been staying healthy.
Oh, I have a way I've been staying healthy, Dr. Sanjay. Look. Oh, does Rosita have a boo-boo? No, Ermita, this is from my COVID vaccine. My mommy and my papi took me to get it this morning.
Oh, Rosita, that's great. Getting the COVID vaccine is a great way to stay healthy.
See, my mommy and my papi said that it will help keep me, my friends, my neighbors, my abuela, all healthy.
Your parents are absolutely right. You know, COVID vaccines are now available for children 5 years and older. And the more people who get them, the better we're going to be able to help stop the spread of COVID and keep everyone healthy.
See, and in 3 weeks later, I have to go back to the doctors and get my second shot. And Kitty...
Right now, the vaccine is only for children 5 and older. So 3.5-year-old monsters, kids like you, probably gonna have to wait a little bit longer until the new year. But scientists are working hard right now to make sure that you can get the vaccine as soon as possible.
Does that mean that Elmo can't play with Rosita or Big Bird?
Oh, no, of course not, Elmo. You can still play with your friends, but everyone needs to keep doing their part to stay healthy. So keep wearing your mask around lots of people, and also make sure you keep washing your hands regularly.
Oh, okay. Elmo will wear his mask.
If you do have more questions about your children receiving the COVID-19 vaccine, reach out to your own healthcare provider.
Do you know what the ingredients are in there by chance? Like, is there an insert?
Oh, there's not an insert.
There's no insert with that?
Yeah, no.
Don't all medications come with them?
You think that's a problem, that your news network lies?
Well, I don't.
Dude.
What did they say?
They lie.
If you notice the dialogue on TV, they're not talking about seniors anymore. Every day they come on TV, they want the children. Well, what we have is called the Trusted News Initiative. You should know about this. This was a planned, announced censorship program. It was announced early in December, and it said, we're going to squash anything on early treatment, anything on vaccine safety, to mass promote the vaccine. And CNN and BBC and MSNBC, they all signed on to the Trusted News Service. So this has been a railroad of propaganda. Propaganda is the promotion of false information by people in charge. And it is false information to say the vaccine is safe when they haven't had a press briefing. They haven't had a press briefing on safety. Here we have the biggest human experiment in history of mankind, and there's no update on safety to the Americans?
You have single-handedly woken an entire county, a nation of parents who weren't paying attention before, including me. We're awake now, and we won't stop.
How stupid do you think we are? You're already in a government capacity telling us that you care more about our children than we do. It's absolutely false. It's ridiculous.
Yeah, keep staring at me. Because this war is not over. You're going to play the game, we'll play it better. And we're going to win. We're going to make sure the school system crumbles. We're going to take our kids out. We're going to defund the schools.
We will not be silent. We are the protectors of our children, and we outright refuse to co-parent with you.
Is anyone on this board concerned about the safety of our children? If not, resign.
Excuse me, can you look this way? Excuse me. Hello, school board. You're looking down. This is the respect that you show the people who you work for. You work for us. You're fired.
Forget going into these school boards and bringing data. You go into school boards to remove them. That's what you do. Forget. They don't follow the law. They don't follow the law. You go in and you remove them. I'm going in with 20 strong men. I'm going to speak in front of the school board, and I'm going to give them an option. They can leave or they can be removed. And then after that, we're going to replace them with nine parents, and we're going to vote down the mask mandates that evening. That evening. This is how you get stuff done. Forget writing your legislators. Forget it. They're not listening. You got to do something. It's us. It's we the people. When I see criminals trying to take my rights and my beautiful children and everything that they're going to do, you're going to have to take my life.
Hi.
My name is Scott Youngblood. I'm a physician, and I'm here to defend science and patient autonomy. Next slide. Nearly 40% of these deaths occur within 48 hours of the shot. It is not until day 40 or so that the death rates return to baseline. If there was no relation, you would see that the low baseline on the right of the graph would be all the way over to the left. Something is happening at day 0 to cause these deaths, and it's pretty obvious what that is. Next slide. The CDC states that any death within 28 days of a positive test, regardless of cause, counts as a COVID death. You could get run over by a cement truck crossing the street, but if your COVID test 3 weeks ago was positive, you are counted as a COVID death. On the other hand, anything within 28 days of a vaccine is not related to the vaccine. Imagine the world that we would live in if these assumptions were reversed. This is illogical and indefensible. In late July, the CDC stated the viral titers of saliva in the vaccinated are just as high as the unvaccinated. This was the justification to make everyone put their masks back on. The viral levels in your saliva are the measure of how infectious you are. Thus, claims that the unvaccinated are spreading the disease and paradoxically putting the vaccinated at risk are all nonsensical. This fact alone destroys the infectious spread justification for vaccine mandates.
How many of you know a 13-year-old whose heart stops? And this is what our government is forcing on all of us and our children. A 13-year-old girl in Halifax, Nova Scotia is in the hospital right now because her heart stopped after the vaccine. That could be your child. It could be your niece, your nephew, your grandchild, your neighbor. The fuck hell is wrong with you people? There are children dying all over the world. There are adults dying all over the world from this vaccine. Do any of you know children who died from COVID? Do you even know kids who had COVID and had any severe symptoms? Anyone? I am absolutely disgusted, not only with our government, but with people out here on the streets shaming unvaccinated people when death is a symptom.
You are a fucking idiot. You're that brain dead, you're that controlled, you're that subverted. You're a fucking idiot. They're your children. Yeah? Fuck your job. Fuck your job, fuck your career, your house, your car, everything else. Your priority is your fucking kids. Yeah, number one, before anything. And these fuckers want to kill him. They want to kill him. These fucking Bilderberg fucking Etonian multi-million fucking pound pieces of shit that they are. Child rape and paedophile fucking bastards, a lot of them. Woman miscarriage, kids violent nosebleeds, all flu-like symptoms. You haven't got a fucking clue what's coming. You haven't got a fucking clue what's coming. I do my research, I go and have a look at it, I expose motherfuckers. I expose their ass. That's what I've done for years. I got my channel taken down a long, long time ago, before all these people started getting shadow banned and what have you. I got fucking spooked. Because I go to the heart. I go and get the fuckers. And that's what you should be doing. Get these fuckers out, because I've had it. I've had it. I'm gonna go fucking nuclear. I'm at that point now. But I'm coming for them. And if you fucking dare get in my fucking way, I'll bury you. And this is a soldier speaking. A real fucking soldier. And all you fucking soldiers out there, and military, police, council workers and all that, grow a fucking spine, because I ain't fucking stopping for you motherfuckers. I'll go through you as well. You fucking leave our kids alone, motherfucker. Fuck you.
A Draper teenager hospitalized with blood clots, and tonight we're hearing from his mother. She spoke with ABC4's Nick McGurk, who joins us live just outside of Corner Canyon High School. Nick, what did she have to say?
She says her son, Everest Romney, is 6'9" tall. He's a 17-year-old, as healthy as you could ever imagine. At 6'9", he plays basketball for Corner Canyon High. So the question is this: how did someone that she says had no underlying health conditions, was extremely healthy, end up in the ICU with a number of blood clots in and around his brain? Doctors found out he had 2 blood clots inside his brain, another on the outside of his brain.
The hardest thing was I let him get that shot. And he was healthy and well before. And I was doing my best, and I thought it was the right thing to do. But you question. You can't help but question it when it all goes wrong.
These vaccines are new. You might see something you've never seen before. Listen to the parents and pay attention.
I was a father of a 16-year-old son, a single parent. I raised my boy since he was a baby. He meant the world to me. I got the vaccine to protect my son. And after in March, April, they're announcing how it was safe for teenagers. Me and my son have never been apart. We're always together. He was my best friend. I always told him it was me and you against the world. We used to go fishing, camping, do everything. We got the Pfizer vaccine because I thought it was to protect him. I thought it was the right thing to do. It was like playing Russian roulette. My government lied to me. They said it was safe. Now I go home to an empty house.
Just for all you clowns out there that saying you guys gotta take the shot, don't take it. I tell you what, as a grieving mother, I'm gonna tell you why. My daughter took that shot yesterday in Las Vegas and she's dead. She took the Pfizer vaccine and she's dead. They couldn't even revive her. I'm begging you people, don't take it. They're killing us. They're killing you and they're killing me. They killed her. 5 hours from that Pfizer shot and she's dead.
I am Ava Piche. I came to tell the whole world what people is doing to the nations of the world. My son took the vaccine on Friday this week. On Friday night, he fell off his bed with a massive stroke with bleeding in his head. Share this live. Share it to the world. Let the world know that it's time for us to come out and speak the truth. Speak the truth and speak it ever. They are killing us. People of Trinidad and Tobago, people of the Caribbean, I'm begging you all, people over the world, stop this nonsense. Because it is killing people. It is killing people. The people, the health staff. I'm giving this message to the health department of the world and all the people who took time to put this thing together and know that the vaccines are killing people. My son is dead. Can I get him back? God, vengeance belongs to God, people.
My name is Sean Link, and I live in Evansville, Indiana. Well, I got to a good start there, didn't I? Okay, I'll try harder. Okay. On January 20th, the day of her first injection, Haley woke up 6:30 in the morning, nauseated and vomiting. She stayed in the bathroom because of the vomiting, and he kissed her and went to bed at 11 p.m. Coroner put her time of death between 1 a.m. and 2. Evan found her at 6:30 that morning.
Her stepson Benjamin was killed by the Johnson & Johnson vaccine on March 14th, 2021. Within 12 hours, he was dead of a cardiac arrest, sudden death. We don't want any more people to die. Benjamin would not want anyone else to die. The autopsy is inconclusive. The medical examiner is changing their phone number, returning refusing to answer our calls or give us a toxicology report. The mainstream media is not reporting these deaths, these serious adverse reactions. We can't bring Benjamin back. And this is not only just about Benjamin, this is about all of humanity. Benjamin would not ever want anybody to take an experimental vaccine that could cause death or permanent injury. If he knew what he knew what we know now in March, which no one is letting anyone know, no mainstream media outlets, nothing. You have to dig and dig and dig to find anything, and even then you're called crazy, and nothing has nothing to do with anything. There's no correlation. Healthy people are just dropping dead of blood clots, everything, and everything is being hidden, and this is horrific. This is criminal. This is murder. And people need to wake up and speak out.
Well, I don't like making videos, but I feel obligated on this one. My best friend's daughter got the Pfizer shot. Right after the first shot, she passed out, went unconscious for 15 minutes and had a heart attack. 2 months later, she's having heart problems. She's 12.
Coronavirus are incredibly common. A large percentage of the world, human population, will have COVID DNA in them, small quantities, even if they are perfectly well or sick with some other pathogen. So the implications are quite clear. If you want to create a totally false panic about a totally false pandemic, pick a coronavirus. There are hundreds of thousands of flu and pneumonia victims in hospitals throughout the world at any one time. To create a false claim of pandemic, all you need to do is select the sickest of these in a single location, administer PCR tests to them, and claim those few people showing viral sequences similar to the coronavirus are suffering from a presumed new disease.
Before long, you have your pandemic. Totally fabricated. All you've done is use a single test kit trick to convert the worst flu and pneumonia cases into something new that doesn't actually exist. Now just run the same scam in other countries. Make sure to keep the fear message running high so people will feel panicky and less able to think critically. Your only problem is going to be that because there's no actual new deadly pathogen, but just regular sick people, you are mislabeling your case numbers and especially your deaths. So your actual deaths attributable to coronavirus are going to be way too low.
We do not need to beat a virus. We need to prevent another fake, unbacked currency from replacing the last one.
As we allow idiotic government policies to close our businesses, destroy our jobs, would this not be a good time to think for ourselves and consider whether we are being told the truth, whether we are being used and set up by liars and corrupt officials for their own benefit?
Hi, Dr. Scott Jensen. They lied to us. That's what I'm hearing every day from voters and patients. They lied to us.
We cannot require someone to be vaccinated. That's just not what we can do.
They told us there would be no mandate.
Definitely not. You don't want to mandate and try and force anyone to take a vaccine. We've never done that.
Remember this one?
Our interest is very simple from the federal government, which is Americans' privacy and rights should be protected.
Well, how about this one?
Needless to say, the right of women to make decisions about their own bodies is not negotiable.
They told us that they would never do this.
It is a matter of privacy to know who is or who isn't.
This is one of my favorites.
You don't want to be mandating from the federal government to the general population. It would be unenforceable and not appropriate.
And this one was so crystal clear.
The federal government should step in and issue mandates, and if not, are you putting the needs of unvaccinated people ahead of the needs of vaccinated people?
Well, I think the question here, one, that's not the role of the federal government.
And then there's this one, the creme de la creme.
No, I don't think it should be mandatory. I wouldn't demand to be mandatory.
Folks, I don't care if you're on the left or the right or the middle, but we should all be concerned that we have been lied to. We have been told over and over again
There'll be no mandate. We wouldn't do this. Mandates are immoral. There's been so much flip-flopping, but I'm not flip-flopping. I'm going to tell you this now, as I've said in the past, and I'll say in the future. A vaccine mandate is immoral.
Absolutely immoral.
Thousands of doctors and scientists worldwide have studied the mountains of data now currently available about COVID-19. These professionals have sincere and grave concerns about the mainstream story of this disease. To follow the science, we need first to debate the science. We need to disagree and challenge each other about the evidence so that we might find the truth. Unfortunately, social media and mainstream media censor alternative interpretations of the evidence so that you, the people, cannot participate in the debate and are thus poorly informed.
If you are considering vaccinating your child against COVID, have you really thought it through, or are you reacting to bullying and peer pressure? According to the Medicines and Healthcare Products Regulatory Agency, MHRA, in the UK, the risk to your child of an adverse event is 8,000 times greater than any benefit. Are you really prepared to expose your child to all the risk while getting none of the benefit? Usually in life we weigh up risk versus benefit, and we do things because of a perceived benefit. But here there is no benefit, only risk to your child. So think hard.
The possible side effects of these injections can be divided into three groups: short-term, medium-term and long-term. Since they've only been in use for 8 months, obviously only the short-term side effects have been seen in humans. But believe me, they are real. Look at the American VAERS or British MHRA databases where the problems are being reported. And we know that this may only be the tip of the iceberg. Short-term recorded side effects include death, anaphylaxis, strokes, heart attacks, pregnancy loss, nerve damage, clots, blindness, seizures, rashes, fatigue, and many others. The medium and long-term effects obviously can't be quantified, since there is absolutely no data yet, but are based on what we know about mRNA vaccines from previous animal experiments and from in vitro observations, that is, events seen in laboratories. These include all of the problems I've already mentioned, and in addition things like infertility, autoimmune diseases, neurodegenerative disorders such as Alzheimer's and other forms of dementia, Parkinson's disease, increased risk of cancers, and premature death. Why would you risk this for your children?
They do not need COVID-19 vaccinations. I would not administer this novel gene therapy to my children under any circumstances.
You let one ant stand up to us, then they all might stand up.
Those puny little ants outnumber us 100 to 1. And if they ever figure that out, there goes our way of life.
It's not about food. It's about keeping
those ants in line.